Isabel in June. It was June 14th of last year. We found out we're having a boy in May of this year. So you're supposed to spread them out a little bit more. Most normal people do, but I'll be 43 for him. So when you're an old man, you just say, let's just, it's like a flower in the autumn, or a squash. If you ever watch pumpkins or squashes grow and it starts getting cold in the fall, and they start putting up all these flowers to reproduce real fast and put out their seed like they're about to die. So I guess at 43, I'm kind of like the squash blossom that's freaking out about to die. Oh, I gotta have some. What's that?
Do you want more kids?
We'll see. She's considered a geriatric pregnancy this month because she's 35 this month. So they count you as an old woman at 35. So if we can have more, safely, we will. We're gonna see.
I thought the age was 40.
It is, but they still call it a geriatric pregnancy at 35 because you can have which actually we'll go through. It might be the next PowerPoint, but you have more risk of Down syndrome. You have more risk of it's called trisomy 21. A few other things that you're higher at risk for. Miscarriage, you can drop a baby, or you can all kinds of stuff goes on. It's crazy. I didn't even know. And then even every time I teach this class, I'm reminded of some of the different things that come up. When I don't do good health or self-care, because for real, I was going to eat this organic minestrone soup, and I'm like, oh, I got 15 minutes. I'm like, Pop-Tarts, here we go. Anybody want a Pop-Tart? As I say that they're not healthy. They're good. But they are pumpkin pie, so they're good until June of 2021. August of 2021. They were all on clearance, so I was like, I'm going to buy a few of those. So now that we're at 2 o'clock going live, I almost ate this, but instead I ate this. So when you don't set up enough time for self-care, you go for the quick and easy Milky Way bar. Snickers, exactly. So, shoot, I forgot you guys were in here. Okay. These masks, how much longer do you think we're all going to have to wear a mask? Forever?
Some people say forever, but I don't know.
I feel like it's blown out of proportion a little bit because we've always had, that's how the flu virus spread, and it killed a lot of people last year. And the year before, I got the flu once and felt like I would die the next day. I slept 20 hours. I had the flu for 3 days, and you're breathing. You sound like Chewbacca from the Star Wars or whatever. The flu is pretty bad, actually. I feel like that's the worst I've had it, but I heard once you get it, you kind of have an immune system to it, So. I also was looking up stress at pregnancy, as this is new research. So we're dipping into chapter 3 here, and there's a lot of detail. So this is where we start slowing down on the chapters. It's about obviously when you get pregnant, how you get pregnant, planned or unplanned. If you're like me, I had one unplanned, and we were excited as ever. We were like, heck yeah, it was perfect timing. The hardest part was that her brother was the Catholic priest that married us, so we had to go to confession the night before the wedding. Sorry, Father, I have sinned. I got your little sister pregnant. And he was cool about it. He's like, heck yeah, dude, you guys get to enter a blessing into the world. And, So, and the other reason you want to space babies out, which we did not do, we actually thought when you breastfeed, and she was using a hospital grade pump, which is a really strong breastfeeding pump. When you breastfeed, they say you don't really get pregnant. Well, that's not true, because within 2.5 months, she got pregnant. And so, again, it's a blessing. It's funny. Not many people have Irish twins nowadays because you see most people have 2 years apart. And that's because after pregnancy, your cervix has to heal and there's different things. And if it doesn't heal properly, it's not, when you're pregnant, it's closed. So the baby doesn't fall out. You know what I mean? And like the muscles and all that stuff, which we'll get into later on here. But basically, right now we're talking about pregnancy, birth, and the newborn of chapter 3. And it's kind of interesting. The stuff they didn't teach you in 5th grade, although did they start teaching you guys stuff in 5th grade for sex ed? Were you like the...
In 5th grade? No, I don't know. I did not start learning about anything like that until like 8th, 7th, 8th grade.
Some schools are for real pushing it up to like 5th. Which,
I went to a Catholic school.
Right, and I did too, so that's why I didn't get it then, but I've heard the public schools are all earlier. Even like DARE to keep kids off drugs, they're doing that in like 5th grade, and I feel like sometimes when you teach them about it, they're like, I want to go learn about it more. But there's differing opinions on it. So as a social worker, what you guys will do, if you ever have a pregnant client, it can happen in probably every job as a social worker except for like hospice, although we had some patients in our hospice. He was only 35, dying, and his wife had a kid a week before he died, which was sad, and that was cancer. So you're assessing expectant parents, whatever their attachments and commitments are. Is that a Facebook noise? How they are mentally representing the fetal infant. So like with the hospice 35-year-old who died of cancer and his wife had a baby a week before he died, like making sure, hopefully they had life insurance set up. Sometimes people won't set up their life insurance until you're like 40 because you're like, dude, I ain't going to die. I have life insurance now as I'm 43 and I got all kinds of old man syndrome.
Do you like working for hospice?
What's that?
Do you like working for hospice?
I do. I really do. A lot of people are like, why would you do? Is it on? Which one is that?
My mom, she worked for hospice, but she ended up, like 3 years ago, she ended up quitting it because it was just, stuff that you see every day and stuff like that.
What did she do for a hospice? Because you can be a nurse's aide, a social worker, a nurse, and...
She was like going to homes.
Uh-huh.
Yeah,
So she would sit with them while they're passing away, too. That's what I do. If I did it full time, I would feel like her. There's a high burnout. How many years did she make it?
She did it for quite some years.
Okay.
Because I was younger.
So she finally, did she get a new job before she quit and just quit it?
Now she does like home health, but it's not with hospice. It's
Right. Okay. Hospice is hard. Some people like it because you say spiritually the people know that they're going to die and they're accepting it and you're like able to work on that spiritual transition. Other people say, well, like if I got the 35-year-old that just had a baby and he's dying of cancer, that feels sad to me. Like that would be hard to witness. So you want to make sure they're set up in whatever way, like whatever their past history of social and professional support is. Like make sure maybe the wife has Fernside is like a social work agency for people that are going through grieving. Oh yeah, and I forgot to tell you guys, on Mondays, I for real have to finish right on time, if not a little earlier, because I have to run to my private practice in Lebanon. I have somebody at 3:30, 4:30, 5:30, 6:30 tonight. So yeah, the joy of social work jobs. So sense of security, that can be monetarily. Do they have housing? Do they have stuff set up? Work and parental leave policies. So you do get like FMLA, and some of our agencies will give us paternity leave now. I don't think Central does, but when I taught at Miami, I could take 6 weeks off when my wife had a baby, and it was called paternity. So it depends on the agency you're working for. I feel like if they all did that, it would be hard to pay you. Is it not working now? Of course it's not going to work. Okay. All right. So here's the biophysical dimension. This is how you get pregnant. This is the stages of prenatal development. So this goes like way back to single-celled mature ovum leaves the ovary. So like literally, if you do, in Catholic school, they teach us about natural family planning. Did they ever teach you guys about that? It might be more in Catholic colleges. And what that is you know that 10 days after you have your period, you are fertile. No matter what, you're fertile. So you got, actually, you can tell I need a rebrief on this because we don't know how to stay unpregnant, but it's like 2 weeks after your period and then you're fertile for 10 days. So there's 10 days in there. If you're to use no contraception, you can get pregnant. And this is when the sperm hits the egg. And those 10 days after the period, you get a single-celled mature ovum, leaves the ovary. They start traveling up the fallopian tube, then they get fertilized. So once the egg drops, the little swimmers are going 100 miles per hour after it. Some of them say if the sperm is there before the egg, you often get a girl because they're like bigger, slower swimmers. Or if it's the opposite of whatever I just said, it's a male because they're faster swimmers, like they get up there quick. Sometimes that can determine sex. The videos that I have saved for you today shows stress can even determine your sex, which is interesting because sex isn't determined until like the 7th or 8th week. So it's basically no sex with the cell division. In 36 hours, you already got 2 cells, 4 cells in 48. 16 to 32. So 3 days later, you got your, a lot of people will say it's just a mass of cells that goes out of your uterine wall into your 4 to 5 days later, it attaches before, the idea is it's smart enough to attach to your like stomach. It doesn't want to go out the cervix because that's when you would lose the baby. So embryo attaches to the uterine wall. Embryo now is a blastocyst joined to the uterine wall, and that's at like the 11th day. So I feel like pregnancy tests would work right when you're like here because you're already giving off the pregnancy hormone, which I don't even know what that is. Your body tests for it.
You can't take a pregnancy test too soon, right?
Too soon? Probably. So whenever that mass of cells is big enough, your body knows, and your body will start giving off, I forget what it is.
Okay.
You pee on the stick and you know if you're pregnant, basically.
Yeah. It's like a letter, so it's like HT.
Oh, right. Okay.
Yeah.
I should know. I'm sure it's in the book. We can look it up if you guys want to. But we looked at it before our wedding. You're like, oh, we're pregnant. Yay! Like it was exciting. Literally though, her dress, like you have to change your dress because when you get pregnant, your whole body type changes. So she had to get a seamstress, like fix the cups. She was kind of okay here, but like it was hilarious actually. And then your second baby, you show more because you're already stretched out, so to speak, if that makes sense. So your body's used to holding a baby, knows it's pregnant. So here's your stages of prenatal development. And I will be done at probably 2:45 because I get to fly down to the private practice. So your embryo is from 2 to 7 weeks. Yeah, this is before you know what the sex is. So in the old days, you had to wait until 20 weeks and they would put like ultrasound on your belly and they look around. You can see them. Actually, if I had on this computer, I could show you ours, like where they like are looking and they're like, it's a boy or it's a girl. Now at 8 weeks, they give you a blood test, which is what we did. And if it's a girl, you give off all the X chromosomes because your mom and baby daughter has X chromosomes. If it's a boy, you have Y chromosomes detected in your body. So now they can tell at 8 weeks if it's a boy or a girl with about 99% accuracy, which is crazy. At the end of this 7th week, you're about 90% formed. You got all your structures. You got hands. You got a fingerprint. You got heart. This is the critical period, so the embryo is most vulnerable to the environment. So if mom's stressed and dousing it with cortisol, that's actually what I wanted to get into for the video. So if this works, there it is. So all I had to do was like how stress affects fetus before birth. And looking at videos, there is a lot. And so much so they're even doing research through the March of Dimes. Pregnant mothers' stress levels can affect the sex of the baby, the study found. Pregnant in a pandemic, that one is again about stress and being locked down, anxiety and panic attacks in pregnancy. This one seemed most to the point. What's that?
I said, I would never ever have a child for a pandemic. I don't see how people could do that.
We're about to have
Or
two.
Yeah, forgot.
Which no, it's true. Like there's a lot of research on it. Like, dude, everybody's like depressed and locked down and but also when you're stressed and you can't go to movies, what do you do for entertainment more likely if you're married or whatever or not? Like that's kind of natural. Like during post Civil War, that's why the baby boom. There's a lot of babies when the men came home from war too, is they were stressed, and there is research on the stress relief. Like that's certainly natural. So here's how the baby. We'll get into this one before the next, because this seemed more to the point. They always have a commercial or two.
For healthy brain development, a child needs to feel secure and protected. Stress can have long-term effects on the developing brain. It can also create health issues for the heart and the immune system.
Any baby who has too much stress will react badly. What happens is that our brain circuits that deal with stress and anxiety and fear or anger, the kinds of things that we experience when we're stressed, will learn to fire more frequently. And then we learn to deal with new things that come along as if they were stresses, as if they were threats. One of the things that happens is that our endocrine system, our hormones change. We get more of a hormone called cortisol, which is a stress hormone. And that clearly affects the way the brain is wired up. And it also affects the rest of our body. So there is evidence, for example, that babies who have a lot of stress in their first couple of years end up in adulthood with more heart problems, more heart attacks and things like that. So the effects are intense and they're very long lasting. Clearly, things like anger and violence are hard on babies. So is deprivation and being left alone for too long. There are other kinds of things like disputes between parents, or violence in a home, or divorce, or illness in a parent, or violence in a neighborhood. All of these things can cause stress directly to the baby if he's exposed to it, but they also affect the baby because they affect the caregiver. And if a caregiver is very stressed, it's hard for the caregiver to be able to respond effectively, sensitively to the baby in ways that reduce the baby's stress. There are a couple of things that parents can do when they recognize stresses in the home that might affect the baby. One is to think about how they can protect the baby from those experiences. So if you expect somebody to be coming in and causing a big fuss in the house and a lot of fighting, maybe it's a good time for the baby not to be there. Parents can also learn how to disagree in ways that are less stressful for those around them. Other kind of thing to think about is how are the stresses affecting you as the caregiver for the baby, and taking a little bit of time and stepping back and getting yourself regulated so that when you're with the baby, you can regulate the baby.
Being a parent is not easy. There are ways to get support and help. There are free services for future parents and parents of young children, such as Healthy Babies, Healthy Children programs, Ontario Early Years Centers, parenting and family literacy centers, community action programs for children.
All right, so that's stress after the pregnancy. I forgot I was telling you guys about the impact on the fetal brain. So here's a shorter one that kind of breaks it down for you.
Baby personalities also?
I think so, yeah. So, because you're right, like depending on how we're taken care of, if we're like, I grew up in a family that was a bunch of screamers, like that's all we did was like yell at each other. So that was just like, there was 5 of us. We were a big Catholic family. I have 2 brothers and 2 sisters, older and younger on each side. We beat the hell out of each other. So like learning how to undo that as you grow up is important too. You know what I mean? Like learning how to resolve conflict without punching your brother in the face and stuff like that. So it certainly can, those are the people that teach us how to grow up. How do I get out of that one? Because it doesn't work. I'm going back when they got the It's so weird. Does that answer your question? I'm hoping I'm like, okay. All right. This presenter mode is going to kill me someday. How do you do it? Is that it? Nope. It's weird as it doesn't show it over on this side either. Jeez, old Pete's. All right. So, yes. Oh, there it is. Okay, go back. If mom is stressed and has a lot of cortisol, this one's telling you how to get help. There's another one that was good though, how stress affects you pre-pregnancy. This one looks kind of interesting. So yeah, stress gives us different hormones that can cause a lot of different stuff, even the sex of the baby, which is kind of crazy actually. So if there's not too many advertisements, I'm going to play this video. And keep in mind, it's also hard to be stress-free completely. Like we always undergo stress, so it's about how you manage it and different things. And diet could be part of that. You know, if I was pregnant, I'd try to do the minestrone soup, but you want a donut when you're pregnant too. I've seen, you know, you want normal types of food and things of that nature. So it's definitely, there we go. Play. Does the internet ever stink over at the dorms? This bad? Wow. I would rip my hair out, I think. And it's probably because we're on the corner room and like the internet signal's all the way over on the other side of the building. So, anyway.
Intense desire.
I think I hit it too many times because I was impatient.
For everything salty, looking for ice cream after.
Dude. Well, not today. So yeah, there's lots of things. Diet could be a part of that. They still do have different exercises you can do while you're pregnant, and like pregnant yoga for stress relief. What are some other ones? Making sure you are not pre-diabetic. Like in the third term, it's easy to become
For every meal, the
diabetic.
ability to devour a bag of chips in one sitting. We pretty much expect pregnant women to have cravings, but do we know why? Science has a few ideas. Women's hormones do an incredible dance while they're growing a human life, and some experts believe those hormones may be the source of food cravings. Medical News Today says leptin and serotonin imbalance can cause cravings, and that the release of endorphins after eating could also be why women have an appetite for different foods. Hormones can also create changes in a pregnant woman's taste and smell receptors, so foods that may not usually be her favorites somehow become her jam. Dehydration could also be a cause of cravings. Pregnant women only need 300 to 500 more calories per day during the second and third trimesters. But What to Expect says they need at least 16 ounces more water per day. Being dehydrated can make you think you're hungry when you're really just thirsty. Whatever the cause of cravings, just be nice to the person with the bump. Bring her the chocolate ice cream anyway.
Yep. That's what I do with my wife sometimes, but then it's not the right kind of chocolate ice cream.
Searching for a new Kia?
All right.
Oh, good news.
I don't even know how to turn it off, but we're just going to roll, so we're on time. So, go back to PowerPoint. Chapter 3. It is interesting. Like, it's been cool to watch some of this as we've gone through our first 2 pregnancies. I mean, it was weird to be pregnant at our honeymoon, and like, you know, there's different things you can't do when you are pregnant. So you just have to be more cautious. So embryo 90% formed. The fetus from 8 to 40 weeks. Like I said, the sex is determined. You'll know if it's a boy or a girl at 8 weeks. You can't see it until 20 weeks. Like they'll try to do a scan to see what thing it is. That's at 20 weeks. Refinement and growth of basic structures. That's the last 2 months. storing fat. So the baby gets really big the last month. Like the last week, it gains a pound alone, I think. Like the last 2 weeks, it goes from like 6 to 7 pounds, then 7 to 8 pounds. And it's like pushing its way out. Early term, or I'm sorry, I skipped one. At 24 weeks, you have a chance of survival outside of the womb. So that's kind of like a key number for a lot of people. 12 weeks is usually when all of the miscarriages happen. So the first 3 months. And then at 24 weeks, double that, the baby can live outside of the womb. I can't remember if it needs the machines hooked up to it or not, though. But 37 weeks is the earliest you would have it at term. So your early term, 37 to 38. Your full term at 39. That's when we had it last year. She was supposed to come on June 24th, and she came on June 14th. Late term, and nowadays people just ask to be induced because nobody wants to carry a baby more than freaking. It's not really 10 weeks. So what's weird about how they count the baby's birth is they count from your last period. So although it takes 2 weeks to get pregnant after your period, it's almost like you get pregnant at 2 weeks and that's 0. So the weird part is that 40 weeks, that's actually 38, if that makes sense, but they always count from your last period. And that's when the baby due date is figured out. So weeks 0 and 1, there is no mass of cells or fetus or baby. But at weeks 2, that's usually when fertilization is. And then at week 3, you actually have like a living mass of cells.
Babies come earlier than 37 weeks sometimes.
They do. It's very common, especially twins. Because imagine if you got 2 or 3 of them in there fighting you like for space. It's like even Isabel kicks her little brother. Like my wife carries her and she just like she doesn't know, but she's just like kicking her stomach all the time. She's just like busy. It's pretty funny.
Other babies do know if somebody's pregnant.
The animals do. All of our cats sit on her belly and stuff, and like it's hilarious. I don't think the chickens know that she's pregnant yet, but she hasn't been outside with the chickens yet. So I'm the one who had to bury the dead chicken last week. I know. What's that?
I said you buried it.
I did. Is if it's like dead, you don't know what it died from. If you kill it yourself, it's probably healthy, but if it's dead, it could have been a disease, so you don't want to eat it. So I'm like, I know. So that's even a more complicated story. I don't know like totally, but it did have signs of, it was called poopy butt syndrome in chickens. And they think it's actually yeast. And so I gave it apple cider vinegar and worked with it, was trying to heal it. And the weird part is the other chickens pick on it and like peck it to death. Like they know when they're sick, and their chickens are mean. And that's where, you ever heard of the pecking order? Like you got to get your pecking order. All right. Well, that's where it came from. Chickens, like the head chicken, like beats them up. And I think they were beating her up. And I found her like stuck way back in the coop, and like her wing got cocked. So I think she just got stuck and froze to death, which was sad, but I did my best. I really did. We still get eggs. But yeah, animals know when you're pregnant. There is, so prenatal life support systems, you guys probably already know this, but the placenta, it's where basically your blood flow is to the baby. Some different countries actually eat their placenta after the baby's born because there's a lot of iron and nutrients, and some people get placenta pills and they take them as vitamin pills. Other people save them in the freezer because they have like stem cell research inside of them that can save you later on in life. So there's services that you can order your placenta frozen and saved for life. There's some crazy stuff about the placenta. And it's because that essential nutrients passes between you and the mom, and it's crazy. The pill, making the pills out of it is crazy. Like they asked us when we had the baby, they're like, all right, what do you want us to do with this? Or like, take it. The umbilical cord, that's what they had me cut. That was kind of weird. It's like,
You cut it?
yeah. Because I had to hold her leg for 3 hours. Like, because they gave her a bunch of drugs and she didn't know if she was pushing hard enough, like the back shot. And then you get drugged up enough, you're just like sitting there, and then there's a nurse here, and then I'm here, and I'm holding her damn leg for 3 hours. So it numbs, yeah. Like you don't know how hard you're pushing, and we feel like that's why it took so long. Then they had to use the vacuum, then they had to go in like that. We were like, oh crap. The jaws of life. The amnion bag, which the embryo floats. So that's why we had to go in early. This bag started leaking. Like some people say your water broke and you see that come out. And hers was literally just a little tiny leak, but they're like, they took measurements and they're like, you should probably stay. And we were there like Sunday, Monday, Tuesday, and Wednesday. Lucky though, because it was a pandemic baby, they fed both of us the whole time. Like we got to order meals. Didn't have to leave, which was cool. So abortion is an option in almost every part of the country. So it's defined as the spontaneous induced ending of pregnancy. 75% of spontaneous abortions occur in the first 12 weeks. Not all vaginal bleeding is a miscarriage. Social worker plays a supportive role. A lot of times you'll have 1 or 2 miscarriages before you have a baby. Separate personal, you separate your personal from professional values. If it does come to abortion and you are working at, you choose where you work, but sometimes you have to separate that out. And then women have less regret and emotional problems when the choice is not forced. So there's actually a new movie about it called Unplanned. Have you guys ever heard that? Have you? Did you watch it?
No.
It's like brand new movie. I would look it up for you guys, but I feel like I'm going to get lost in that again, and I have to finish in like 19 minutes for real. So yeah, it gives you kind of the idea of a person who had worked at a clinic. It's called Unplanned. It's actually kind of interesting. So there's your placenta. And the baby actually, I think, is like head first. Or the other way. So like when your baby's growing in your womb, it's like this. But towards the end of the pregnancy, the baby rolls over. And the idea is the head is down in the bottom. Doesn't always happen that way, so they have to, that's when sometimes a cesarean section is needed. Sometimes the umbilical cord wraps around his neck, like that happened to my brother, and he came out blue. So that can be bad. They always talk about like if you're 1 centimeter, 2 centimeter. I think you go to the hospital when you're like 3 centimeters, but then when you have the baby, you get to 10 centimeters, which is insane. That's freaking like the body is miraculous that it goes to 10 centimeters. So if you have a family of big heads like mine, man, get a C-section. Labor could be 12 hours, 14 hours. So that's when you dilate is at 10. That's like when, usually the baby is able to come. I don't even know how to, it is 10 centimeters. Whatever 10 centimeters is. I'll get a ruler or measuring stick for you guys next time. But I was like, are you serious? Like when my wife told me that, I'm like, huh? The body is miraculous, for real. Like it's amazing what the body can do. So we ran to the hospital. We freaked out. She's leaking 12 hours. Then the second part is only supposed to be 10 minutes, but we, of course, took 3 hours, and she freaking hated it. Like she had to push for 3 hours plus. Like, and they only give you like a minute break. They're like, okay, 1, 2, 3, and it's like baby's delivered. Which again, they had to pull her out. They were like metal prongs, like, man. I make it sound so wonderful. But they have a lot of good drugs. They use like fentanyl inside of that. Yeah, what is that called in the back? Epidural.
Yeah.
I looked up at the bag. I'm like, you're getting fentanyl. You guys heard of what fentanyl is? And carfentanil, that's what like people are dying out on the streets from. If you don't dose it properly, they say like a speck this big you can overdose on. And then carfentanil, a speck that big. In Cincinnati, they put it in the weed this summer, which was messed up because a lot of people overdosed on that weed, which is crazy. They put it in weed. So people would smoke it. The fentanyl was on it. I think a sting operation, they found them, but that was crazy. Then we had to wait for the placenta, which is creepy. You're waiting to birth that thing. Like,
You have to wait on it.
I mean, anything forced is not good on the body. You know what I mean? It's best to be natural, but we were technically induced because her sac was leaking. But if you can do it natural, it's supposed to be the healthiest. If you don't do fentanyl, it's even healthier, but you're going to hurt like hell. She couldn't feel anything, but then the 2 months after you do is they have to use stitches. The fourth is 1 to 3 hours. There's recovery. They do skin on skin, like they even had me like take my shirt off and hold the baby. And like her little footprints, like on the stomach. It was hilarious. And that golden hour, so this is key. They used to not do this. This is like, 100 years ago, they probably never did that. They just take the baby away like, it's a boy. Now they're like, this golden hour, you got to have skin on skin. It's critical for bonding, growth, development of the baby. I wish I did have access to this computer. It actually was kind of cool. Like the first time she opened her eyes and stuff, you're just like, whoa.
Is that so that the parent won't have what is it, postpartum depression or something like that?
It helps, yes. So with the mom, and more importantly with the baby. So you're not supposed to wash them. They're like covered in white crap, but it's important white crap. It's like a good bacteria on their skin. And they used to wipe it off right away. Like, dude, that baby's dirty. Well, no, it actually has really important bacteria on it that you're not supposed to bathe it for like several hours, like even the next day. And they used to like wash it off right away as it looked like mucus and whatever. It's like, oh, it's all white, like it's covered in mucus. But you want that mucus to stay on the baby. And you're right, it can help for mom connecting, breastfeeding also, because that can help connect on an individual level, and it can prevent postpartum depression. I don't think ours had a cone-shaped head, but she was like 6.5 pounds. Now she's about 18, 7 months later. Yeah. They lose weight at first. They triple in size the first year. It's crazy. And this is a way like social workers can measure if the baby is okay. I always get too excited talking about this now that we had the baby that I'm going to go over on time. I've got to finish in like 5 or 10 minutes, so don't let me forget. You guys I won't let you forget for real. So this APGAR score is to see how the baby adapts to life outside the womb. Like, I don't think we spanked it to make it cry. You know how you're supposed to make them breathe? They're breathing through gills inside the womb, I think. Or they're taking the mom's oxygen. They're using mom's lungs. That's probably what it is. And the mom's lungs give blood. But once you cut that umbilical cord, the only way it can oxygenate the lungs or the blood to the lungs is with its own lungs. You want to check its heart rate, its breathing, the reflux. Yeah, they did all kinds of they pressed on its knees and see if her hands do weird crap. She was yellowish, so that meant she was jaundiced, which a lot of alcoholics get. That's I forget what they said that's from, but they're like, oh, it'll go away. I'm like, when it's your own baby, you're like, what the heck? Why is the baby yellow? Is it going to die? And she was fine, but it still was weird. People were like, dude, I think your baby's jaundiced. We sent pictures to our family. They're like, baby's jaundiced. Oh, she was okay though. 7 to 10 is considered good. So this APGAR score, 5 to 7 poor, you might need to put the baby on that machine. 0 to 4 is likely associated with neurological defects. Like nowadays, we do have a lot of babies that are opioid babies. In the 80s and 90s, they had more crack babies. Now we have opiate withdrawals, and they're kind of it's crazy to see some of the babies. And they just have social workers hold them and rock them until because they have to detox. All the heroin has to get out of their system and all the whatever. So, and a lot of times that's when Child Protective Services will try to get mom into rehab and whatnot. They test the first poop of the baby has 6 months of the blood usage of the So their very first poop has all of that blood history, which is crazy. I didn't know that you could test 5 months old poop. but it's like a black tar poop that has everything that they drank, ate, consumed, and whatever. It's crazy. Some of the biophysical hazards, if there's like frequent vomiting, well, yeah, complications of pregnancy. My wife didn't have the vomiting on the last one or the morning sickness, but with a boy, you get different reactions. So there's like testosterone in your system. So she is nauseous a lot now, and she's trying to take 6 credit hours, and it's hard to, you like got a newborn, you're taking 6 credit hours, and it's not easy. So I give her all the props. If you do have vaginal bleeding, we actually ran in and thought we had a miscarriage at 12 weeks, because sometimes the fetus will detach from like the wall, and I guess it rips some of the stuff with it. And then she saw that and she freaked out. She's like, I just lost the baby. So we ran, got her scan, and they were like, you're actually okay. That was the first time we heard the heartbeat at like 8 weeks. But yeah, the placenta previa, when the placenta separates from the wall of the uterus, that's what we saw exactly. And we were like, what the hell? And she thought it was the baby dropping out. Toxemia due to protein in the urine. Eclampsia, sometimes that's like high blood pressure. There's gestational diabetes, which they thought she had. They make you drink this orange drink, and you have to digest it within 30 to 60 minutes. And they do it 2 different times. The second one she failed later on. Then they make you drink. It looks like a McDonald's orange drink that used to sell. I don't know if they still sell that stuff, but it's full of sugar, and your body has to break it down real fast, or you have diabetes. And she was the second time she was able to break it down, and she was okay. And another bad thing you could get is intrauterine growth retardation. So there's things, the doctors, if you go every month like you're supposed to, they check for all those. So this is your normal maternal age, 18 to 35 is normal. 35 and older, they consider geriatric. So she's a geriatric pregnancy. We are pushing it. I get to go right up to the edge. You only eat 300 extra calories, which kind of seemed like not that much to me. That's just like an extra French fry. I'm like, don't you get to eat whatever the heck you want? And apparently no. They're like apple, blah blah blah, stuff like that. In the last 3 months, you do high proteins, so whey protein or things like that. There can be maternal stress and illness that affects the baby. Also, there's you could have multiple gestations, are riskier and have younger gestational ages. Sexually transmitted diseases can be transferred. So herpes definitely can. And this is something that you get to learn sometimes in college instead of in high school. But like if you have a cold sore, which is herpes here, it can be transferred all 4 ways, like mouth to here, to there, and that can be transferred to the baby. So that's why if there is a herpes outbreak, they'll do a C-section to avoid the baby's head like touching. And about 80% of Americans they're like cold sores. So literally a cold sore is herpes, and that can be passed all 4 ways. That's an STD to watch out for, and then some others that can be passed on at birth. We'll finish with this one and the next one. We're at least halfway through it. If there is drug use, any substance that can cause a birth defect. So they used to say you could have 1 or 2 drinks during pregnancy. You're not supposed to drink anything during pregnancy. So in the old days, they're like, oh, it's fine. I swear my mom smoked while she was pregnant with me. We get in fights about it all the time. I'm like, there's a picture of you smoking. She's like, shut up. I hate you. I'm like, you were drinking too. That's why I'm so messed up. She's like, no. So we mess with each other. It increases your chance of miscarriage, low birth weight, cognitive abilities, etc. Drug use can cause addicted infants. You could have difficulty actively engaging in their environment, so they would have increased risk for abuse. And also, alcohol is the biggest preventable cause of developmental disability. So if you don't drink, there's a lot of research now on fetal alcohol syndrome. They really did think you could have 1 or 2 drinks up until like the 70s when I was born. And in the 80s, they're like, dude, don't drink anything. I think in the 90s, they're like, you can't even use mouthwash with alcohol in it. So anyway,
So babies that do have like come out addicted to whatever the parent is doing, what do they do? Like they just let them go through the withdrawal?
sometimes they have to detox them. They let them go through the withdrawal. They might have other drugs that like steps it down. Alcohol is the worst because in addiction recovery, alcohol is the only withdrawal that can actually physically kill you. You would think heroin withdrawal would be worse, but it's not. Heroin feels like it's worse, and they're freaking out like, I'm going to die. But you can't die from a heroin withdrawal. You can die from an alcohol withdrawal. So they sometimes have to give you a little bit of alcohol to like step it down. Heroin, crack and cocaine, all those, you don't. How do you die from alcohol? I guess they sometimes are called delirium tremens. The body just gets used to it somehow. I would have to look that one up because I'm not that smart, but for real, you die from alcohol withdrawals, and it's the only drug you withdraw and can die from the withdrawal with. That was shocking me. I'm like, it's just alcohol. Like, what the heck? What about heroin? And they're like, no, you don't die from heroin withdrawal, but you feel like you're going to die. Like you take a shower and they say it feels like it's pounding on the back because you're used to, on heroin and any opiate, you're just used to pain-free, like you're floating in a river, like, ugh. So you do anything and it hurts your body, like you aren't used to pain after using opiates for a long amount of time. So it feels like you're going to die. Alcohol's the only one that kills you. It is important to have prenatal testing. They say drug testing and ultrasound, like it'll identify anomalies, and then you may require ethical decisions of whether to terminate pregnancy. Some people do let you terminate if it's like trisomy 21, which is Down syndrome. So we'll stop there as we're like exactly halfway through at the so I'm good. You guys, you want a Pop-Tart? For real, I got like 10 boxes of these. Yeah. I was just saying, I meant to eat this, but I was in such a hurry I had to eat this because it was time for class. So.
Thank you.
You're welcome. And then we'll see you guys next time.